We're going to be speaking to you today about the cardiac conduction cycle, brought to you by Kinsley Scamaldo, Bill Jarrett, Ryan Penrod, and Kate Evans. First, we'll do a little introduction. Cardiac neurons are influenced by the sympathetic and parasympathetic nervous systems of the autonomic nervous system. At rest, the myocardial cells have a negative resting membrane potential, and nodal cells have the ability to depolarize spontaneously without stimulation from the autonomic nervous system. So the simplest way to follow the cardiac conduction cycle would be to break it into steps. So step one would be the S node, which is also known as the SA node, also known as the pacemaker, generates an impulse. Step two, the AV node impulse conduction. Step three, the AV bundle impulse conduction. And lastly, step four, Purkinje fiber impulse conduction. And we're going to look at all of these a little bit more in depth. So starting with step one is the SA node. It is located in the posterior wall of the right atrium near the superior vena cava, and it's composed of nodal tissue, which I mentioned before is the tissue that's capable of spontaneously depolarizing without influence from the autonomic nervous system, and it's got characteristics of both muscle and nervous tissue. So stimulation by the parasympathetic nervous system would be the vagus nerve, and this would decrease the heart rate. Stimulation by the sympathetic nervous system would be spinal nerves T1 through T4, and this would increase the heart rate. The SA node sets an intrinsic rate at 60 to 100 beats per minute, and this causes the atria to contract. And like I said earlier, the SA node is referred to as the pacemaker because it is responsible for the rest of the heart's electrical activity. So moving on, the second step, AV node, and it lies on the posterior inferior region of the atrial septum near that opening of the coronary sinus, and its job, it delays the impulse by approximately 1/10 of a second to ensure the atrial ejection before the ventricles can contract. And it's referred to as the capacitor. And its intrinsic rate is 40 to 60 beats per minute. And the AV node serves as a protective measure against atrial fib and atrial flutter by using this decremental conduction, which just means the more often the AV node is stimulated, the slower the conduction will be. Step three is the AV bundle, also known as the bundle of His. This is located between the atria and the ventricles, and it transmits impulses from the AV node, and there's three branches, the right branch, left anterior, and left posterior branches. And these give rise to the Purkinje fibers, and its intrinsic rate is 40 to 60. And you'll notice as we move more distal from the SA node, the intrinsic rate will decrease. And lastly, step four is the Purkinje fibers. This is located in the intraventricular walls of the heart, and it triggers the muscle fibers in the ventricles to contract, and this is the slowest intrinsic rate at 50 to 40 beats per minute. So taking a closer look here, we can see the SA node here, so this is going to be your pacemaker and set the electrical activity for the heart at 60 to 100 beats per minute. And then the impulse goes to the AV node here, the capacitor, so it's going to slow it down by 1/10 of a second, allowing the atria to eject. Then the AV bundle here, branching into the Purkinje fibers down here, which is going to allow for the ventricles to contract. One thing to note is this Bachmann's bundle over here in the corner. As the SA node generates that impulse, in order for the left atria to get stimulated by this conduction, it needs this Bachmann's bundle, which is a broad band of muscle that's going to allow for that depolarization of the left atria. So speaking of cardiac conduction along with EKGs, electrocardiography, also known as an EKG or an ECG, is the interpretation of the electrical activity of the heart over a period of time. And there's different components to this EKG. The first being a P wave, which is going to signify the atrial depolarization. QRS complex is when the ventricles are going to contract or depolarize, and that T wave is the repolarization of the ventricles. Taking a closer look here, we have the beginning of the P wave, which the SA node is generating the impulse, and we're starting to excite the atria. The actual P wave is that depolarization or the excitation of the atria. The beginning of the QRS complex is you're starting to excite or depolarize these ventricles, and the actual QRS complex is when the depolarization of the ventricles has occurred. So there's cardiac action potentials which are broken into 5 phases, 0 to 4. Phase 4 would be resting membrane potential. 0 is going to be that rapid depolarization phase. Phase 1 is inactivation of fast sodium channels. Phase 2 is that plateau phase. And phase 3 is rapid repolarization. So looking at it visually here, we have phase 4. So this is going to be a resting membrane potential. 0 is going to be that rapid depolarization, and you can see sodium rushing in. Phase 1, potassium and chloride are going to go out of the cell. In phase 2 here, you can see it plateaus. There's a flat line, calcium going in and potassium out. And then phase 3 is that rapid repolarization and the potassium going out of the cell to return here to phase 4, which is that resting membrane potential. So if there's one thing we want you to remember from our presentation, it's the order of cardiac conduction. Simply knowing that the SA node is going to start the impulse 60 to 100 beats per minute, sending it to the AV node, which is going to stop for that 1/10 of a second, allowing the atria to eject, moving to the AV bundle and its branches, down to the Purkinje fibers where the ventricles are going to contract. And that's our presentation on cardiac conduction. Here's some works cited, and thank you for watching.